One of the challenges people have when you go to a large, busy clinic like we have is that it can be frustrating if people don't know your story. So what we've done to prevent that is assign people to their own nursing team. So they have their own nurse, they have their own physician who they can access. So that physician and the two nurses make up their team, and it provides consistency of care, and people know their story and they know what they bring to the table in terms of hopes and emotions and fears and past experiences, that those all can be brought to the table every interaction.
In starting Olive Fertility Center, it really gave us a good opportunity to look at the care we were providing, and for the most part we were really happy with the care, but we wanted to really make it patient-specific and what we call patient-centered care. We know that patients will encounter all of the employees at one point or another, but it was important to us that they had a core team that they could always come back to.
The physicians here in our practice have been treating patients for years. And one of the struggles that patients have in fertility care, because it's a relationship we have with patients, and the care can be quite complex with many steps involved. And one area that patients continuously said they'd like us to focus on is making sure that they communicate with people who know their story. We've restructured our clinic where each physician has two nurses that work with that doctor directly, so that if one of my patients, for example, has a problem or a question, they pick up the phone and talk to one of the two nurses that work with me directly.
So when did those symptoms start? Oh yes, the sore throat drops. Yes, that's fine. Yeah, you can take those.
And that's something that we've really found very valuable, not only for ourselves, for our own continuity and knowledge of what is happening with the patient, but the patient has a continuous touchstone, someone that knows them. They don't have to repeat their story, and someone that can really follow them through the process from A to Z. So I would say the patient-centered care has been key to some of the positive changes we've made here at Olive.
I just love what I'm doing. I mean, I love the interaction with the patients, and I like to do all the different steps along the way with them. For me, that's a very rich experience, and I feel privileged to be a fertility nurse.
We have the patient portal, which the patients can access all the time. They can send us a message. So they have instant access to send messages to the doctors and nurses, and they can also follow up with phone calls and call us as well.
Going through this whole process, the whole thing, your anxiety level is through the roof. You have questions about everything, and every dumb question I emailed her about, she answered me. So that was amazing. I knew that I could call the nurses line and I could leave a message and somebody would call me back, and I knew that my question would be answered.
I have one particular memory that was always very special to me. It was a couple who had had many cycles of IVF and they had all failed, and they then opted for donor eggs, and it was the most magical moment to see this couple walk into our clinic with that little baby in their arms.
I'm calling you about your test results today. You went for a blood test this afternoon, and I have some very good results for you. You're pregnant.
I like to think people come here and they're treated well and with respect, and they're listened to, and no matter what the outcome, they feel that they had their best possible chance with people that really cared about them. That's what I hope people would take away from our clinic.